Bindu Sukpal ma'am has come, joined?
Yes, she is joining, ma'am. She has messaged that she is joining.
Okay.
I think 12, I'll start now.
Yeah, I think we can start. She will be joining, ma'am.
Okay.
We can start.
Good morning to everyone.
Okay.
Today good morning to everyone. Today our special invitee, Ms. Ani Kumar, Vice President, North Region TNA Headquarters. And today our eminent speaker, Dr. Sukpal, Madam Tangam, and co-chairperson, Ms. Saini, coordinator and moderator, Ms. Bindu, Ms. Dolma, all EC members, dear participants, on behalf of TNA Headquarters, I'm Dr. L. Gopichandran, President TNA Delhi Branch. Welcome you all for our 14th webinar on Empower Nurses to Empower Nurses. So this is our 14th program. Everyone, I think, maybe come to aware that the Empower Nurses who are all self-motivated and doing their best in their area with their potentials. And they are not only motivated themselves, they are motivating others with their visions, their work, and also by the inspirations. Today we have our eminent personality, Annie Madam, there, who is the backbone of our TNA Delhi branch, who is our visionary leader, who is the one helping us, guiding us, directing us to do this such kind of programs. And she is with us to give some share her vision to us. And two eminent speaker, I think well-known personality, Dr. Subal and also Madam Tanga Madam. They are doing their excellent, extraordinary, exemplary work in their area, and they are also with us to share their vision and to empower us. Once again, I welcome you all for this 14th webinar, and over to Annie Madam to say a few words.
A very good morning to all of you. It's my proud privilege to present here to welcome you all for this 14th webinar of Delhi State Branch. And I'm very proud to announce that the Delhi State Branch, the very charming personalities of the Delhi State Branch, like President Dr. Gopi Chandran, Secretary Madam Shaini, and Mrs. Bindu, and each and every member of the executive committee are doing a very good job and to empower the nurses. So you can see yourself that it is the 14th webinar where so many nurses are getting empowered every week and every month. That is very good, and I use the opportunity to welcome our eminent speakers, the great personalities in the nursing fraternity, like Dr. Sukpal Kaur, who is the Associate Professor, PGI Chandigarh College of Nursing, and Madam Tangam Gomma, CEO, CYGNA Healthcare, who will be talking about the empowerment in nursing, especially what is true empowerment, and also what are the maximum outreach of nursing where we can reach. And I hope that all the participants will be enriched by these two sessions. Welcome you all once again. Thank you.
Thank you, Annie ma'am, for welcoming each one of us, and especially the speakers. Greetings to you from TNI Delhi State Branch. A very good morning to each one of you. It's my privilege to introduce Ms. Tangam Gomas Madam, who has done her RN/RM BSc Nursing, and she is the founder and CEO of Signia Healthcare. Next, I would just brief of 38 years of rich experience leading to become an entrepreneur with focus on patient safety and nurse empowerment. Currently involved in nurse leadership development, nursing administration, nursing audits, risk management, infection prevention, critical care, tracing, and in studies to make relevant and immediately application on certified in high fidelity and the Green Belt Six Sigma, and distinguished instructor and master trainer. And patient safety ambassador for Patient Safety Movement Foundation, is a member of FICCI National Health Committee. A few about awards and honors. she has received 50 outstanding in women in healthcare in 2017, Z National Healthcare Leadership Awards, Women Leadership Award in 2019, and in 2021, Luminary Star Riga House 2021. So I welcome Thangam ma'am to take this session on the webinar Empowered Nurse to Empower Nurse. Over to Thangam Goma.
Thank you very much, all of you. I'm very honored to be here with Trained Nurses Association of India, and I'm a member of TNAI for very, very long time. We have had some interactions earlier also with Madam Evelyn, Dr. Roy George. So we try to work very closely with TNAI because I personally believe, being the largest body of nurses in the country, the voice of TNI must be heard at all levels, and especially at the governmental level, where we want to see empowerment of nurses. Because I just finished, speaking about transformational leadership in another forum. I'm just thinking that how much is empowerment. So let me try to take this topic, true empowerment, through my own journey. It is better to talk about what I have experienced in my life. Maybe that might be easy for everyone to understand, rather than talking about a lot of principles and theories around it, so that anybody can learn from anywhere. I think translation or application of that is the challenge. So just give me a minute. Let me just pull up my presentation. Can you all see that?
Yes, ma'am.
Yes, ma'am.
Okay, great. I really like the TNA's, the other unofficial logo called Proud to be a Nurse. And that is what I am. Every time, wherever I go, I would love to say that I am proud to be a nurse. So I want to make this one a slightly interactive one. The first question I'm going to ask is, what picture comes to your mind when you think of true empowerment? Can I have some answers in the chat box? What picture comes to your mind when you think of true empowerment? Whatever comes to your mind. That's your answer. There is no right and wrong. Can I see some? I opened the chat box. I'm not seeing any answers. It can be a person, it can be an attribute, it can be anything. True empowerment. If that nobody can put in the chat box, okay. Empowerment to do quality nursing care. Okay, all right. Let's have a couple of more because we are so short of time. I don't want to. So my picture of true empowerment changed from my age to age. Maybe when I was a nursing student, I looked at my nursing director and said, that is true empowerment. Can we have everyone mute themselves, please? Someone is talking. Okay, Kerlin says gender equality. Okay, that's a very common terminology people attribute empowerment to, is about, the female empowerment or feminine empowerment. So there is gender equality. So that's a nice thought process. And sometimes I think that, is it the culture that we have been brought up, and majority of the nurses are females, that is kind of pushing us to be submissive in the health work environment? That's a question I keep asking myself. Is it that why our nurses are not willing to speak up when they have to speak up? Is the reason that they don't ask questions when they can ask questions? Not sure, because they are not confident to showcase the knowledge that they have even got. So, agenda today is dream bigger and reach higher through true empowerment. And I'm going to showcase this to my story. This is my story I'm going to share. So there are a couple of reflections here for you. The true empowerment is taking responsibility for what we want and what we don't. whether as an individual person, whether as an individual leader, or whether as a mother, whether as a brother, father, sister, whatever role that we are playing. True empowerment is when you take responsibility for whatever that you want and what you don't. And I also add one more thing: take responsibility for all that decisions that we have taken in our life. Even the success that came out of our decision and the failures that came out of our decisions, they all are empowering moments. The only failure is when we fail to learn from our failures. So leaders become great not because of their power, because of their ability to empower others. So empowerment based on at what level you are. So today, as I stand, for me, empowerment is more about giving back to my fraternity whatever that I can. And that is where the definition of true empowerment, we will just look at it for just a moment. This can be defined as knowledge-backed authority. Knowledge-backed authority bestowed upon an individual to make relevant decisions successfully towards business objectives. So when you talk about a nurse leader or a nurse, based on whatever role that we are playing, let's say that I am a staff nurse. Question is, do I take the leadership at the bedside? Do I know my patient completely? Do I have the knowledge? Do I know that what authority I have to speak about my patient? Can I make the relevant decisions? Do I know what I need to inform to the doctor when, and before jumping to inform the doctor, do I know what to do, basic 2-3 things? And overall, am I aware that when I am doing the best as a bedside nurse, I am contributing to the larger objectives of the organization and also of the country? Understanding that your small role that you may be thinking will be contributing to the higher outcomes of our profession. These are questions to be asked. We have couple of people raising hand. Do they have question or do they have? Okay, they are saying hello only. Okay, no problem. So I'm sure all of you believe that nurses make the difference. Do you think that we make a difference? Can we raise your hands on the emoticons? You have emoticons there. You can raise your hand there. Okay. So I'm sure that all of us agree that we make a difference. Now, we don't make a difference just by saying that we make a difference. We make a difference by our actions. We make a difference by our inactions. Correct? I was in another webinar or a virtual meet a while ago. There was a story that was being shared by one of the very senior nurses. She said that she got admitted in one of the hospitals for hysterectomy. And she said that in all the 5 days she stayed, only once a nurse came to check her pulse. Vital signs were taken by the doctors. When she asked what happened to the nurses, doctor said, they will not take. The dressing was changed by the doctor. The part preparation was also done by the doctor. Why? Nurses, they don't like to do it. Now the question is, do you think that this is empowerment? This is really sad. We give all that we can do to somebody else and to the doctors, and then we say, no, doctors try to rule us. Why wouldn't they rule us if we are going to not to take the right role that we are supposed to do? And I remember the school where I was trained way back before 1980. Okay. That is the place where we were taught, me as a first year student, not even first year, at PTS, we had that probationary time. I'm taking the BP of the patient. So that means I'll take couple of times, because first I will do palpatory systolic finding, then I will take the BP. The consultant came for rounds. I did not stop my procedure. I finished taking, and my consultant, he was very amused and he was smiling at me, just a 17-year-old kid. And when I finished, I turned back and I said, "Good morning, sir. Sorry to keep you waiting. I was taking the blood pressure." Then he told the ward sister, he said, "This is how Holy Family should produce nurses." I'm so ever grateful to my organization who put that confidence in me, who you showed the way that what empowerment means. If that particular day, if someone told me, "You should stop everything that you're doing when consultant comes," that's what I am going to learn. So I'm going to tell you a lot of my personal story to actually tell you what exactly is empowerment. So before we get into my story, a little bit of theory, I just wanted to explain to you about empowerment. One is blind empowerment. Blind is because of the organizational structure. Somebody is given the authority, so there is entitlement. So if I am the nursing director, I'll say I am the nursing director. So there is no vision, no plan, erratic growth, and things can come down just like that, because there is innovation happens, but there is no, it is not result oriented. So many times when I go for courses or training, I always say, what is the result of that particular training? The question also will be 4 years when we are training a nurse, what should be the outcome? The outcome should be, the nurse should be the patient ready, but we are not having patient ready nurses. Are we thinking? So when I was the nursing director, I used to tell my educators, I don't care what you teach or what you train. When I go for rounds, I want my nurses to know what they are supposed to do. Then you get a tick. To my ward sisters, I used to tell them, I don't want to come and tell you what to do. As long as your patients say you have a great team and the clinicians say the nurses are the best in this ward, I am not going to come after you. So that means results. So the true empowerment, so let's come to true empowerment last. The disempowerment definitely is a very negative connotation. That means very rigid hierarchical. That means my way or the highway. I'm the boss, so what I tell is rule, so I'm not going to listen. And then there the team is completely isolated. Only the leader thinks that he or she is empowered, but they are not really empowered. Constrained empowerment is like very much controlled. There is no free thought. If I have my team, I will tell them what to do and I will tell them, you do this, you do this, you do this. But I don't ask them, what do you think? Is it a good idea? So it is almost like being told what to do. Again, not a good model. True empowerment is always strong and there is continuous growth. And there is a sense of ownership, not only from the leader, from the entire team. The question is, as a nursing profession, are we taking ownership for our own growth, for our own visibility? This is a question that we need to ask everyone. Now, we cannot boil the ocean, but we can definitely make a difference as drops of water. What does that mean? In my circle of influence or my circle of empowerment, can I make the difference? Maybe Tankam's influence, circle of influence is very different from Bindu's. Question is, will Bindu also try to do what she can in that environment rather than getting bogged down with this thing, why it cannot be done? There are enough things to complain about. I asked a lot of questions here. They are tough questions. But does that deter? I will tell myself, no, I will do something only when these things are fixed. No, it's a continuous journey that I have been taking for the past so many years. That's me graduating in 1980 from Holy Family. And after that, 1980 itself, I got an opportunity to become ward sister. So you can say I became a leader very, very young. It's because Holy Family taught us to be a leader even at the bedside. That's how I got that empowerment. My system, my bosses gave me that opportunity to feel empowered. 1982 to 1997, I was head nurse and supervisors in India and abroad. Now, the major change came in 1998 when I became a mother. And within 2 years, I decided to be a single mother. So the person that you see Tankam today is not only a nurse and a leader. I became a single mother at a time when it was very tough to be a single mother. But that gave me a lot of empowerment. It took a lot of courage for me to take the decision to bring my son alone up. But yes, we always have a lot of people supporting. I'm hugely grateful to my family who was with me. 2001, I started my journey with Fortis Healthcare as the nursing superintendent. That was the first hospital of the group. I had a completely blank page to write down how the nursing department will be structured. I wouldn't say I was 100% successful, but I was fairly empowered to create a system that is working even today in Fortis Healthcare. So, making a difference in whatever role I had was important. Then I left Fortis in 2012. I became Executive VP Education. From 2012 onwards, I am in education training of professional nurses along with consulting and advisory. So 2017, I moved to another organization, and in 2020, I founded my own company called Signia Healthcare. So I'm the founder CEO of my own company, and that's my son a couple of years ago, both of us. So that's the journey, and I would say, is my journey? Am I happy? I would say I'm extremely happy and grateful to God for all the opportunity that was given to me. Now, the question is, to be truly empowered, do we take advantage of every opportunity that comes our way? Let me give you a couple of examples. I've been training all levels of leaders outside Fortis. Inside Fortis, I have a lot of experience, but outside, that means I have dealt with nurses across the country. I'll give you some very, very fundamental understanding. I must have tested nurses for basic infection control practices across the country. I'm still waiting for more than 10 nurses who got more than 80% marks. So what am I trying to say is that somewhere we are not empowering ourselves. The basic knowledge for basic requirement for empowerment is knowledge. So now if the basic knowledge is missing, how can we make ourselves empowered? The basics of infection prevention, the basics of drug calculation, the basics of medication safety. There are excellent nurses, but they are very few. They are not the norm. So let me come back to my story. What did I do? I cannot tell about somebody else's story. So what did I do? I can only say that I always try to be authentic. Authentic in the sense taking choices which are right every day and showing up and then trying to reflect that the choice I took, did it make me a better person? Right now I am 63 years old. If someone say that have I done everything in my life and I have reached, so when we do leadership assessment, a lot of people give themselves 5 on a scale of 1 to 5. So I always tell them, the day I give myself 5, that day I'll stop learning that particular domain because I think I'm the best. I'm always work in progress, and I will be WIP maybe when I go to the grave also. I will never be able to say I have done everything. But yes, I learned very early, the day I became a team lead. From the staff nurse, the day I got a team, I realized if I want the same results that I wanted, I have to empower others. I have to coach others. I have to support others. I have to guide others. Then my empowerment comes. I am only as good as my team. I realized that many, many years ago. So I invested in developing my team. And the most influential leadership role that I had in my career, because I'd been a staff nurse all the way up to group nursing head. So it was my Most satisfying role? When I was a bedside nurse. What was my most influential role? When I was a ward in charge, because I was able to, convert my team into a better team because they were working with me day in and day out. Now, what do I know now? After 63 years of spending life as a human being on this earth, as a nurse leader, as a mother, something I learned: stop asking what will people say. What will others say? If you are convinced what you're doing is good for better benefit of the people around you or better benefit of your team, go ahead, speak about it, do something about it. Don't say what will people say. And don't be afraid to fail, not at all. Don't be afraid to fail and be afraid not to try. This is very, very important. When you don't try, that's the day that you never know how powerful you could actually become. So the true power lies in empowering others. So true empowerment is about when you as a leader, when you are empowering others. So in summary, me as a senior nursing professional, I would say that when we did a speech competition last year, the young nurses or the millennials or the Gen Z, what did they tell us? They told us, listen to us, tell us what you're going to do, involve us, ask us, is it okay to do this, and appreciate us. This is what the current generation is asking for. They are not telling us, always tell us what to do and then punish us. No, they are telling, ask us, then you tell us. So the best way is to ask the team, hey team, what do you think? I will play this video in a moment. I will go to the next one, and as a parting gift, I will play that video in a moment. So my last word on true empowerment will be unchain yourself. Don't get caught in what you know so far. Unchain. Open your brain, open your heart to new things, the new world, the new generation. It is very important. And very, very important that you feel confident in yourself. I have seen a lot of nurse leaders that the moment they see a smart nurse in their team, they become very insecure. Then they start complaining about that nurse. Oh, he thinks himself he's too smart. He's asking too many questions. I have more than enough stories to tell. If you are a truly empowered person, you will not become jittery when you see another smart nurse. You will be secure in yourself. So, for true empowerment, I would say eliminate fear from you and from your team. Provide unconditional, non-judgmental support to your team. When you support your team, don't say, I will do this and then you do this to me. I did this to you for, then why didn't you do this? So just let it go. Just let it go. Whatever you have, share it, give it. Give the gift of true knowledge. And whichever role that you are doing, whether you are a nurse administrator, whether you are a bedside nurse, whether you are a team leader, whether you are an academician, lecturer, dean, ask the question, am I sharing enough? Am I trying to make other people, better than me? That's the question. Before I leave, I will play the little video for you if there is couple of minutes. Now, when you look at this picture, you will say, ma'am, what is this picture all about? This is about fashion or what? I put these pictures just to impress upon you. Always stay young when it comes to knowledge seeking. You want to have new things. You want to put new dress, not material dress. You are changing as per the time demands. It's almost like a fashion changing. So nursing is also changing. Demand on nursing, the demand on nursing is also changing. Can we? I don't know. I'm so sorry that the people are not muting themselves. So the last word will be that, do you have the courage? I just need to stop here. I will ask the organizers, do I have a minute to play this 2 minutes video? Can I do that? I have
Sure,
only 1
ma'am.
minute. Yeah?
Sure, ma'am. You can do it.
Yeah, I'll just put the sound on and I will.
The most important characteristics of leadership. Vision, charisma, you know. I know plenty of incredible leaders that aren't big Steve Jobs visionaries, you know, they're just not. And I know some fantastic leaders who do not have charisma. They're quiet and super introverted, you know, and they're just not that exciting to talk to, spend time with. When I say charisma, I mean the traditional definition of it, which is more about energy. I believe charisma is undying belief in something, and that they have in spades. But I think courage is the one thing that all great leaders have to have, because we are surrounded by overwhelming forces every day of our lives pushing us to play the finite game. You know, if you're a public company, the markets, all they want for their own selfish gain is for you to make short-term decisions. The pressures are overwhelming. If you're a numbers-driven person, the pressures are overwhelming. If you're in survival mode, the pressures are overwhelming. If you have a spouse who spends more money than you can make, the pressures are overwhelming. All the pressures around us, even the way we treat competition versus rivalry, like we feel like we have to win all the time. The pressures every day on us are absolutely overwhelming for us to be finite and to prioritize the short term over the long term, to prioritize the urgent over the important. And it takes unbelievable courage to put the important before the urgent. It takes unbelievable courage to resist all the pressures coming from selfish outside parties. It takes unbelievable pressure to do the right thing. So yeah, courage is it. Which begs the question, how do you get courage?
Yeah.
And the answer is, you got to have people in your life who love you and believe in you. You got to have friends, you got to have colleagues. You got to have employees that when you just don't have it in you, you just don't think you can, you just don't have it, somebody says, I got your back.
So friends, I'm going to stop with the last thought. The true empowerment is when we empower others. When we falter, when we fall weak, there are team members who will come and say we can do it. That is true empowerment. When our team members, thank you so much for TNI, and thanks for the special invitation. Thank you very much. And I would say now I'll have to take a leave. I have another class to go to, so I hope it's okay. Thank you, Bindu, Annie ma'am, Shiny. Thank you, everyone. Can I take leave now? Thank you.
Thank you so much, ma'am, for having primed such a beautiful session. And I'm sure your rich experience and your real role modeling has added, that richness to this topic. And I'm sure you are the right person to talk about true empowerment, because we have seen you empower many young lives. And we have heard many of your life journey in many other forums as well. And we really thank you, ma'am, for taking us through this elaborate session and highlighting and make us understand what is really true empowerment through your role modeling. Thank you so much, ma'am. We are really pleased.
Thank you very much. And good day to all of you. Bye-bye. Thank you.
Ma'am. Thank you so much. Thank you so much. We would continue with the session since ma'am had to leave for another session. We would take this time to introduce our next speaker, yet another expert in the field. She's an empowered nurse. She's none other than Dr. Sukhpal Kaur. She is the Associate Professor cum Academic in Charge in National Institute of Nursing Education, PGIMR, Chandigarh. And she carries with her a lot of experience of over 25 years as a nurse, academician, researcher, and leader. She's a voracious research worker. She has carried out various intramural as well as extramural funded research projects She's in the editorial board of various prestigious nursing journals, expert in various committees, numerous committees. I was just going through her curriculum vitae, and I had a very hard time jotting down the important points. And as well as she's a voracious writer as well. She has authored many books, edited as well as published various research papers in both indexed as well as non-indexed journals. She has delivered various keynote addresses, talks in conferences, workshops, presented papers in national and international forums. And yet, ma'am is also awardee of various prestigious awards like the Paul Dudley White International Scholar Award, awarded for publishing high quality research papers, awarded certificate of appreciation by Sigma Theta Tau International, as well as numerous awards to her credit in the best research paper presentations in national and international forums. We are really privileged to have you, ma'am, with us. And over to you, ma'am, for your session.
Thank you so much, Bindu, for such an elaborative introduction of mine. And I'm really privileged to be part of this forum. And at the outset, I would like to thank TNI, all the representatives of TNI for organizing such very, very wonderful talks every month. And very consistently, you are organizing all these talks. And these are really very, very beneficial for all the students and the participants all over the country. So I would like to share my screen.
Sure.
Are my slides visible?
Yes, ma'am. Yes, ma'am, it's visible.
Okay, so it's at presentation mode now. Okay.
Yeah. Yes.
So the topic I'm
proceed.
going to discuss, it's a little bit different. And here again, as ma'am was talking about her own experience, I want to talk my own experience, that how we have maximized the nursing professionals working in the hospital in the community settings. So it's again my own experience, and I would like to share those experiences. So I'm going to talk about the maximizing the community outreach of the nursing professionals, how we can do that. So talking about the background of my presentation, we know that what is happening over the period of time, just a minute. What is happening over the period of time? There is an increase in life expectancy, okay, because of the various technological development and the otherwise treatment modalities available with us. But this increase in life expectancy, it's not only the bed of roses, because there are a number of health problems which we develop over the period of time, and the person is liable to get more health problems once we get older. There is a decrease in the physical function, and we also know that because of the increase in life expectancy, the number and the percentage of the elderly and probably the disabled people is also on the rise. And it is also said, it has been documented that the person after 70 years of age, there is always 1% of decrease in the overall strength of the person yearly. And this is really going to affect the overall health of the individual at large. Now, why there is an increase in life expectancy? Because of the various treatment modalities as already discussed. And we know that because of the type of lifestyles we have nowadays, there are a number of the person is liable to get various non-communicable diseases. For example, diabetes, cancer, chronic lung disease, other NCDs, stroke. This is one of, again, the most common problems nowadays we see the people are suffering from. And otherwise, we see that India is a hub of road traffic accident. And on the top of that, we see that majority of the road traffic accident, they are because of the two-wheelers. And in the two-wheelers, again, this is a fact that majority of the people, they are between 20 to 40 years of age. And this is one of the most productive period of life of an individual, if we say. And we see the patients are suffering from certain orthopedic, certain head injuries. And many a times it has been seen that the patients are on bed for throughout the leftover period of his life, and the person really lives in a very, very vegetative state. So what is happening because of all these things? The person is liable to be bedridden because of the various health issues. So in what all health issues we see in these patients, like you will see, for example, if the patient has developed stroke, there could be chances for the paralysis to develop. There is a decrease in the physical function of the individual. The person is on the bed for the rest of the period of his life. And once the person is on bed, there will be decrease in muscle strength, inadequate nutrition. And the person, what is happening because of all these things? The side effects will be that the person can, because of immobility and other risk factors, there are more chances for development of bed sore. There are more chances for the DVT to happen, pneumonia, UTI, and the other problems which are related to immobility. So all these things, if we see that they are preventable and they are manageable. What is the solution? Solution is only the nursing care. And good nursing care, that is the only solution available. And where this nursing care will be available, the options if we have, it is in the hospital, which we see majority of the nurses, they are working in the hospital, or it can be in the hospice. For example, if we have the long-term care facilities available, and otherwise it will be at the home. So the persons will be given good nursing care in all these three institutions. However, what is there in the hospital? There are a number of constraints in the hospital, and majority of the hospital, if we talk of the Indian settings, they are the acute care hospitals, wherein usually we see there is a shortage of beds, there is a shortage of doctors, and there is a shortage of nurses. So what we do after the initial management of the person, once the person's condition is stabilized enough, the person is discharged from the hospital, and then onus of care lies with the patient himself or herself and with the patient's caregivers. And otherwise also there is a concept of early discharge of the patients. Early discharge means so that we have the patients have less number of complications. The person's condition is stabilized, they are getting discharged from the hospital. So once the person is getting discharged from the hospital, the person has to be dependent on the patient's caregivers whosoever is available. And if it is, they have the resources, then it's okay. Otherwise, it becomes really a big problem for the patient's caregivers, and whole of the family get disturbed because of that particular patient. So we see that the care of bedridden patients, usually there is a mismatch between the demand and the nursing care provision. And usually this is the unfulfilled gap. And otherwise, if we talk of the long-term care facilities, these are not one thing available in Indian settings. And if it is there in certain metropolitan cities, these are very, very costly. And it is very, very difficult for a person for a person who is belonging to medial, income class. It's very, very difficult for them to hire certain person or to admit the persons for the long-term care. And in Indian setting, again, we see that there is no formal cadre of the caregivers, and there is no training as such, standardized method of giving training to the caregivers of the patients once they are admitted in the hospital. So way out, if we see for these patients, is the home-based care. This can be given by the family members, or they are also called the informal family caregivers, or they can be the trained caregivers. Trained caregivers here, again, I would like to say that it is very, very costly. Recently, I had the experience, my father had stroke. So we had to hire some trained caregivers, and it was costing around 30,000 per person during daytime only. So it was around 50,000 for a person. Two persons were hired. One person was working during the daytime and another person was working during the nighttime. So it's very, very difficult for a mediocre family to hire those caregivers. And otherwise, again, if we talk of the home nursing, this is not available. But if we talk of if we train the patient's caregivers, there will be a lot of benefits of the informal caregiving if they are properly trained, because there will be personal touch. If the person is being given care by his or her own family members, there will be personal touch, and they will be more satisfied that someone their own is providing care to them. And definitely the person is in the home, person is providing care to the patients, the family life will also be intact. There could be better quality of life, and definitely it will be less expensive. But the quality of care by these informal caregivers will be questionable, because we don't have the proper system of training the caregivers at the time of discharge from the hospital. So the dilemma of informal caregiver lies with that there is no system of training. There is always a financial constraints for the middle class families. There is a lot of frustrations once the caregivers are not aware. They want to do something for the patients, but they are too frustrated that they cannot do anything for their patients. So they totally become helpless. And moreover, they have the other responsibilities of providing care to the family, to the they have their own responsibilities of looking after their own career and financial other constraints in their offices or in the home. So we see that there is a lot of gap between the care provided to these patients in the hospital and the home. In the hospital, where we have a qualified manpower, however, in the home, where we don't have the trained caregiver, and usually the untrained caregivers are there. And if we talk of the nursing workforce, they are mainly located in the hospital. They are definitely well qualified to work in the hospital. However, they are overworked. There is acute shortage of nurses in Indian settings. And we also see that there is, again, a mismatch between the nurses required as per the INC and the existing. For example, in general ward, if we say the ratio should be 1:3, but usually even in tertiary care centers, we see that one nurse has to take care for more than 20 patients. Similarly, in ICU, there should be 1:1 ratio, but we usually see that one nurse has to look for more than 3 patients. So we see that even in the hospital, the nurses are insufficient. Then what to think of, posting of the nurses in the home care settings. So the solution to all these problems is maximizing their outreach. How we can maximize the outreach of nurses? By teaching the caregivers. Where we can teach the caregivers? In the hospital. Once the person is admitted in the hospital, immediately we should be involving the caregivers in their care. And we should try our level best that they are trained, they are skillful enough, especially for certain basic care which they can provide to their patients in the home care settings. And another thing is, if we have certain group of people who could be involved in providing, in visiting the, community settings or certain communities from the community areas, we can involve certain nurses who can be trained and who can visit the patients' families and can train them and can teach them, and they can identify their needs, and accordingly they can teach them and can provide care, and later on they can supervise them whether they are providing care in a proper manner or not. And we know that the nurses, they have multidimensional care. They are the caregiver, they are the managers, they are the protector, advocator, educators, communicator, and collaborator. So these are the various qualities which are there in a nurse. So why not to utilize such qualities by providing quality care to the patients? So for such roles, she has a multidimensional role. So for such role, what we can do, we should be developing certain SOPs. We should be developing certain modules, certain multimedias. For example, CDs were initially there. Now we are developing certain mobile apps. We can develop certain handouts, certain booklets, which can be given to the patients or the patient's caregivers at the discharge of from the hospital. In the home care, in the hospital, we should be training them properly, and we can give these type of handouts to the patients in their home care setting so that they can consult whenever there is any need, or they can contact the doctors or nurses in the hospital so that they don't have to repeatedly come to the hospital, even for dressing change or even for certain other minor things, which beds or dressings, etc., which they can do in their home care settings, etc. So with this background, we tried certain interventions which we tried in our institutions, and with which we were able to provide care and to take care for thousands of people in Chandigarh. And I tell you, this concept again came to my own experience. It's because of my own experience. When my in-laws were bedridden, I was providing care to them, and it just came into mind that we are the healthcare professionals. We are from the medical background. My husband is a physician. So we thought that we had many number of problems. Think of the people, general public, who are providing care in the home care settings, and the patients really land up into many complications, because it's not possible to bring a bedridden patient for each and everything to the hospital. So it just concept came into my mind. Then I wrote one project on bedsore, and I submitted to Indian Council of Medical Research. And within a month, it was financed by them, because it was all innovation, and no one had submitted. It's such a simple thing, but no one had. We always talk of the hi-fi things, but we don't talk of the basic things, which is basically the need of an individual and which is basically the role of nurses to be fulfilled. So I would like to share certain examples which we had from here. And then these are the certain projects I'll be talking later also. And then we had number of other evidences. We gave these types of topics to our PhD, to MD, MPH, MSc nursing students. So this is just to give you just a highlight that one of the project was comparison of impact of 2 family caregiver training packages on the quality of care of operated neurosurgery patients. Then another one was a hospital-based, community-based RCT on prevention of pressure ulcers in the orthopedic patients. Another one was the home-based care of the operated neurosurgery patients. So our focus was basically on the patients who were requiring long-term care. For example, orthopedics and neurosurgery patients, we know that they are discharged from the hospital in the dependent state. So we started focusing our care on these topics, and we started giving these types of researches to our students. These were the 2 projects which were sponsored, financed by Department of Science and Technology. This is for the elderly people, TIEA, and another one was the ICMR project. So this was on the effect of an intervention on prevention and management of bed sore in the elderly patients in the DST type organization, and in ICMR we focused on all the patients irrespective of their age. And we know that why we focused, as it was one of my own experience, and we know that bed sore is one of the most common problems which we see in these bedridden patients. In hospital setting, we usually see that the prevalence is around 10%. However, in the home care settings, because the people are not trained enough, they are not bringing, it's not possible for them to bring to the patients to the hospital. So it has been seen that more than 80% of the bedridden patients in the home care setting develop this debilitating problem. So it's a major burden of sickness and reduced quality of life for the patients and their caregivers. And the cost associated with care of bed sore was the 3rd highest cost after cancer and cardiovascular diseases. So number of evidences are available. This is just to share what we did in the DST type projects. So all the bedridden patients who were likely to develop bed sores, they were divided into 2 groups. One was for the prevention package, who were at risk but didn't develop the bed sore. And second one, we tried certain treatment packages also. So for the prevention package, again, further we divide them, randomize them into 2 groups. To one group, we just gave whatever interventions we developed, and second group, we gave them personal touch, personal counseling, and all the, whatever care is to be provided, all demonstrations were given. And then we had the end-line observations. We followed them up over a period of time. It was around 10 months follow-up of these patients, 1 visit per week, per month, then 1 visit fortnightly for 3 months, then 1 visit 6 monthly for 6 visits. So we followed up these patients over the period of time, and then we had the end-line observations. However, in ICMR projects, we had 3. It was similar, but we had 3 types of dressings which we tried in these patients. So this was altogether a separate group of patients on which we had this project. And here the follow-up was for around 22 months. And over the period of time, we were visiting these patients, and we were observing whether the prevention package group developed certain bed sore, or whether the treatment package group, which drug was better in the treatment package. So we followed up them over the period of time. Then what all interventions we taught, this was the booklet which we prepared, how to position the patients, what are the various positional techniques. We also demonstrated them the various types of exercises, even lifting and moving of the patient was taught to the patient's caregivers. Even we visited the patient. This is one of the very senior doctor from PGI, both husband wife were the doctor couple, and he was bedridden patients, and it was very, very difficult. We see that once a bedridden patient is there, and mostly in Chandigarh, we see that husband, wife, both are elderly people. So it's very difficult for them to move the person from one place to another person. So we used to visit them. He's a professor from School of Public Health in PGI. So we both were visiting the patients in the home care settings in Chandigarh and nearby Chandigarh. We even demonstrated how to perform the exercises. The various agents used were saline and the neosporin. However, in ICMR project, we also saw the effectiveness of the hydrocolloid dressing along with saline and the neosporin. So this is me and other project staff which project staff who were demonstrating how to do the dressing, because dressing, again, for dressing, it will be difficult for them to bring the patients to the hospital. So we tried in the home care settings. So it was again very, very difficult to recruit the patients. Then we had press release, we had a lot of radio talk, TV shows, posters. We developed a Facebook page on which we told, we wrote that exactly what is being done in beach care. This is a Facebook page. This is the audio recording going on. We had a lot of press coverage in the newspapers. We had displayed posters in various units of the hospital where there are more chances for the patient, like in neurosurgery and in the orthopedics patient. This is the training of the project staff going on. This is the training of the caregivers, you can see here. So what we saw that they were trained for the active and passive exercises. They were trained for the proper positioning of the patients, regular inspection of the bony prominences, giving good nutrition. So here you can say the compliance at the end of the visit was around 100% for each patient. There was a decrease in the stage of the bed sore from 1 to 2, and then you can see here the number of persons who were in stage 3, they were going towards the stage 0 and all. So maximum benefit we had from the hydrochloride dressing, followed by neosporin and the saline dressing. So these are the experiences which the caregivers share with us, that we cannot take the patient to the hospital. Your visit in our home have benefited a lot. The exercises which you have taught and benefited me, and I have started walking. If we were consulted and trained even 11 years earlier, then there would have been great improvement in your patients. PJ has done a great job of taking care of the patients in their homes. It's very difficult to take bedridden patients to the doctors. Initially, we didn't have the knowledge. Now, because of your training to us, we have started doing all the preventive measures or the treatment, dressings and all. So how has these interventions helped us in maximizing the community outreach of a nursing professional? You can see here that we covered over more than 10 lakh of populations through various medias, and around 300 bedridden patients were really benefited out of all these things. So what was the overall benefit of having these interventions from families' point of view? If you take, there was less travel time, there was less cost involved, less visits of the patient to the hospital, and less disturbance of the families. There was more empowerment of the caregivers, and they were more confident because they were trained enough. And in the hospital, if we say, we save the doctor's time, we save the nurse's time, and there was less utilization of the hospital services. These were the various booklets which we developed. Apart from this, after that, we developed certain, and this is one of the for the stroke patients. This was named as medical application based post-stroke care strategy. This was named as MAP. Various mobile apps were developed. So this was for the stroke patients. Another one was the post-operative neurosurgery patients. Another one was the breast cancer patients. So we had tried all these interventions through mobile health, and it was really a very, very effective approach of taking care for all these patients. So just to conclude, I want to say that successful in all these interventions, they were quite successful in reducing the incidence and prevalence of bed sore among all the bedridden patients, and caregivers and patients, they welcome the approach. So our future plans are development of more smartphone based apps on care of the bedridden patients, also care of the bedridden patients using Skype and email, and all these interventions are being developed, and they will be tried in near future to come. So there is a need that public health and the nursing personnel should take up the relevant research projects to further refine these caregiving modalities. And we really acknowledge the support given by DSTI, ICMR for the financial blessing, and elderly individuals and the other patients and their caregivers for the support. Thank you so much.
Thank you so much, ma'am, for the very, very elaborative session on maximizing the community outreach of nursing professionals. So ma'am has started with why the need. Because of the changing trends, many changing trends, there is increase in patient requiring long-term care, and a good nursing care is the solution. But due to many constraints in the hospital, as well as non-availability of hospice care centers in India, it is not possible. So empowering the family member, ma'am said, is the caring, is the solution actually in caring for their ailing members. But there is no system of training them. So the solution is we as a nurses, nursing professionals, who is known for caring for the patients, we must train the family members during their stay in the hospital. And ma'am has also guided us various ways of doing it, whether be it the development of booklet or apps or any kind of videos, anything through the use of IT technology. And at the end, ma'am has given many examples how it is doable. It's not just the talk, ma'am is saying, it's doable, and they have shown evidences, many evidences ma'am has shown of how to go ahead with this and how they are benefiting the ailing population. Thank you so much, ma'am, for the very, very elaborative session. And I think there is no question so far, ma'am. Let me see, a minute. Ma'am, there is no question as such.
Okay.
So can we wind up, ma'am, or should we wait for a while, or what to do? Normally we used to have 1 or 2 questions at least, but today we don't have any questions for both the sessions. So I think we should wind up, ma'am.
Yeah.
And it's exactly 1 p.m. We are not on time. Thank you so much, everyone, for joining. Thank you, TNA headquarters, for always supporting us. And thank you, our EC members, the Delhi State Branch, and to both the speakers, both the eminent speakers, Dr. Sukhpal Kaur and Madam Thangam. Thank you so much for being with us today and empowering our nurses. Thank you so much.
Thank you so much. Thank you.
Thank you, participants, as well.